Nobody wakes up in the morning thinking, I'm going to go to A&E today. Nobody knows. Nobody knows who it's going to be.
Paediatric trauma call, 15 minutes.
Code red, helipad response.
You're having a heart attack.
We want to be in and out of scan in the next 10 minutes.
I can't feel any pulse.
A&E reception, can I help you? Yeah, 24 hours, 7 days a week. I love that question. What's your opening hours?
St George's, London, one of the busiest and most advanced A&E departments in the world.
Beautiful. It's as if we've done it before.
We are there when awful things happen to pick up the pieces.
We have a 2-year-old who's kicked like a horse.
We see the unpredictableness of what happens in life, and we're suddenly having to explain why it's gone wrong.
I can't feel my left leg.
You'll be okay.
A place where life
A&E selfie!
Down below. Too slow.
love
Such a good boy.
So proud of you.
and loss
I'm still here.
unfold every single day.
So we don't shake hands at this hospital, we fist bump. Can I have a fist bump?
All the patients you're about to see were treated in just one 24-hour period.
Hello, darling.
You genuinely do see the best of people in this job. You'll see strangers rushing to the aid of someone they've never met. You just see things that make you realise just how important the people in your life are and the people around you are.
That's it, big breaths, well done. Let your arm go all floppy. Good man. I was lying about how much it would hurt, because you wouldn't have done it otherwise.
No, it did you.
It's one of my favourite things to do. But yeah, you've made my night. I've always had a quirk wherein I can play the fool at times. On paper, when you become a leader, you should leave that part of you behind. However, I find that quite difficult to let go of.
Tonight in Resus, Simon is a senior nurse on duty.
Yes. Okay. Yes. At work, I'm very together. As soon as I put the uniform on, I get into that mindset of being in control. Whereas in my real life, it's a different story, really. I'm coming up to 30 now, and I am very much single. Ooh.
Hello.
It's the gay consent for touching a patient. Trying to find the right person, quite a challenge. Sometimes, you know, you do get hurt. We just spent 20 minutes talking about that. Obviously, you don't spend 20 minutes doing it because the patient will be dead. I think the bravest thing we can do is to put ourselves out there, to love other people and allow yourself to be loved, because bad stuff happens. And when it does, you really want somebody there by your side. St George's Resus. Okay.
A 78-year-old man is being rushed to A&E with breathing difficulties.
Adult priority call ETA, 7 minutes. When you hear that patients coming in and they have breathing problems, you really want to know straight away, is their airway intact? Anything that affects your breathing has the potential to kill you.
The man's wife, Irene, called 111 and has accompanied him to A&E.
He was very short of breath, and I can normally find a pulse. I couldn't find his, and I think it was because it was so erratic.
Just relax back.
Barry didn't want me to call an ambulance, but he had a bacterial infection and only out of hospital for about a week. That's why I was so worried about him.
Barry's 78 years old. He discharged recently out of hospital. He's been continually short of breath. He does have a history of a right-sided pneumothoraces, which have been drained in the past, so that was our concern. He does have a complex non-productive. There are some cognitive issues. There is a diagnosis of dementia, so his conversation might be confused at times. Okay.
Can I listen to your chest now?
Over this summer, Barry's been in A&E 5 times. He has quite a complex medical history. Barry was diagnosed with emphysema 10 years ago. He'd had a stroke as well, and now he's got dementia.
Hello, sir. My name's Simon. What we're going to do is get you set up on the monitor with ECG monitoring and blood pressure, and we're going to take some bloods as well. Do you know where you are at the moment?
Yeah.
Where are you?
He's always hospital.
Do you know which department?
Well, it's on the end.
Okay.
Concentrate, Barry.
It's okay, take your time.
I'm just on the reception.
Ah, the A&E, yeah. If the patient is older, they're not as robust, which means we can't treat them as aggressively as you would someone 20 years their junior. And part of you knows that potentially they're not going to make it out of hospital.
Can you sit up and I'll support you? Come on, you can't lay down like that. On the previous occasion he'd been in hospital, they drained over 1 litre of fluid from his lung. And the same symptoms were there, so I was worried that it was happening again.
Doctors have prescribed a nebulizer to help Barry's breathing. And they've requested a chest X-ray.
So all you need to do is take some nice deep breaths.
Slipping down. It's your nose that's at fault.
It's been 20 minutes since 78-year-old Barry was brought to A&E with breathing difficulties.
Hey guys, take a quick chest X-ray if that's okay. Just bring the machine down in front of you there.
He was recently hospitalised with a chest infection, and doctors suspect it's returned. Barry also suffers from dementia.
Can you tell me your date of birth, please, Barry?
24th of the 4th, 37.
That's great.
He can't always produce.
No worries. Okay, very deep breath in. Hold it there. Excellent, breathe away.
Barry was quite a bit older. He was my brother's friend. And when I was doing my O-levels, he came and sat with me while I was revising. Embarrassing to say, it was biology I was studying. He walked me home once. I didn't realise he was walking me home. I thought he just happened to be going that way. I was naive as well, I suppose, because I never had people falling over themselves to, you know, invite me out or anything like that. So it was very refreshing to have someone like Barry who talked to me. And he said, oh, well, you're the kind of girl I would like to marry. And I said, well, you've never asked me. So he said, will you marry me? I was really excited, but more than anything, it sounds strange, I was amazed because I never thought anyone would ask me to marry them. It seemed such a big step to take. But we were happy because we were both looking for somebody who would be just the one person that we'd stay with. All right.
want to know is if there had been a breath test at the football.
I hadn't even had a drink before.
No.
The only person that was drunk was the stag.
I've heard everything. A bunch of late 20-year-olds on a stag weekend, and the only person drunk was the stag.
Well, no, we all got drunk after that, obviously.
Well, you got drunk while you were waiting to get your arm done.
No, I got my arm done and then went out drinking with everyone.
Life must go on.
I wonder why I had a service when I got it out of my handbag and I haven't now.
If you put it to your forehead, you normally get better reception.
Don't be stupid.
Just try it, I bet it sends. I can pick up the signal, is there? There's nothing in there. Oh.
St George's Resus, adult or paediatric.
A 75-year-old man is being brought to St George's after falling down a flight of stairs.
Adult trauma call, ETA 15 minutes. When you have an older person coming in with falls, you're worried straight away. They're more at risk of breaking bones and internal injuries. And their recovery sometimes isn't straightforward.
No more moving.
Right, this is David Lowe. He's 75 years old. He's fallen down the full flight of stairs. He's fairly comfortable while he's still, but any coughing or deep breathing, he's got pain in the left side of his chest.
Hello, David. How are you doing?
I'm rather deaf, so you have to speak slowly. I'm sorry.
Okay, no worries. All right, David. Just put this around your arm, okay? And then listen to your chest.
David's wife, Jane, has come to hospital with her brother-in-law and sister.
That paramedic, he said, are you both independent at home? Do you have any carers come in? I wanted to say no, I can still do a handstand.
We were up to visit and staying with my sister, but David is not familiar with Linda's house. And he got up in the middle of the night, in the dark, didn't put his glasses on, didn't turn the light on, and he mistook the top of the stairs for the bathroom door. We were worried about him. You could tell he was in a lot of pain. He couldn't move.
Very good, thank you very much.
It was just sad, really, because he didn't have anything on. I can't help it. It was funny. Linda, she's a nurse. You know, she's seen it all before. But she did get a little towel out of the downstairs bathroom and just cover him up, which made it look even sillier.
To ease David's chest pain, doctors have prescribed some morphine.
Yep.
They suspect he's suffered internal injuries during the fall.
Any pain in the ankle?
No, that's fine.
And the here?
Oh.
Well, what was that?
No, sorry, that was a bit toe that I kicked.
It looks very bruised down there.
Yeah, I think I broke it.
How did you do that?
You can't believe this, but I have dreams where I fight people and punch and kick.
Oh.
And 2 days ago, I was so frantic in my sleep that I actually kicked the wall.
Oh, that's a bruise. Quite sore.
I'm a good sleeper, and I normally have a very good night's sleep, and often very pleasant dreams as well. But I do have occasional dreams when I get into sort of aggressive situations. I punch, clench fist punching, and I kick out with both legs. And sometimes I've just punched the pillow.
Do you remember when he first hit you?
He was kicking me, really. He'd be cuddled up fast asleep, and then suddenly this person lying beside you would kick me really hard. And so I'd wake up and start kicking him back. So we'd end up kicking each other.
We've ordered x-rays to see if it's broken or not.
Well, that's why my wife has to sleep in a separate bed, otherwise I kick her.
I don't blame her.
They weren't regular every night stuff. It was just every now and again this stupid thing would happen, and obviously, you know, it was mortifying to think that I'd just thumped Jane.
I don't know why I have that aggression when I'm asleep.
Yeah.
I'm normally quite a peaceful chap, you know.
Yeah.
Going back to my school days, it's usually kids that are misbehaving, so I go in for the kill.
So how long have you been having these dreams? Since you were a teacher?
No, the teaching were anxiety dreams then.
Okay, yeah, I can imagine.
When I was teaching, I always had dreams in the summer, which were anxiety dreams about going back into teaching. One of them, which did recur, and it was always the same one, I had to assemble the whole of the school onto the playing fields, which I had to do when it was fire drill. But I had to do it this time and teach them Romeo and Juliet with no clothes on.
What would I do with that bit of paper? Should have been at work an hour ago.
Well, it is not my fault.
It's your fault.
How?
Because you're the one who got me pregnant.
Takes two to tango. And I mean tango.
What did he do?
He had an electric saw and he dropped it. Gee.
82-year-old Bob has been brought to Majors after a DIY accident at home. His wife, daughter-in-law and grandson were out when the incident happened.
Did you have to?
Bloody hell's been playing it.
Did you have to?
Now, what have we told you? What have we told you? If you didn't want us to come round tomorrow, you only had to say. Pillow.
What are we going to do here?
Do what?
Next time you want anything cutting down, you ring me.
Yeah, all right.
Robs, I'm not having you in here with cuts.
I'd rather be me than him.
Do you like a saw?
Saw? Yeah, I do, depending on the saw.
You're not having the key to the shed anymore. It's gone.
Honestly?
We're cutting off the electrical supply.
So that's hanging off the wall anyway.
Do you know what he was up to?
Yeah, I think he was trying to cut down a tree stump, trying to make it smaller so he could extend the shed. The circular saw was broken. I think the blade attachments or something wasn't working, so he did it himself somehow.
I was using that grinder with that new blade I put on it, and you can't stop it once it starts. So I thought it would make it easier to do the job I wanted to do. It went wrong. That toe, I think they're hanging off.
No, it probably is knowing you. If you're going to do it, you'll have done it properly.
Yeah.
I've been banned from ladders. I had one or two instances, I fell off a ladder out here, you know. I'm banned from everything by the family, but I don't take a lot of notice of it.
Blood pressure went down to below 100.
Oh, it would do.
Because he'd lost so much blood.
They thought it could be a suicide attempt. That's what the police said, because he was on his own, he was at home, and there was a lot of blood.
More than suicide, does that sound right to you?
Nah, not at all. He loves life.
Good job you didn't see it all.
It was bad enough seeing what was left.
Oh, it's terrible.
Policeman said, good hose down would be all right out there, he said.
Every day in work, I see family and loved ones rallying around a patient, and it's hard not to get affected by it. Sometimes I do worry about ending up alone, but Love isn't easy, so hopefully one day I will find someone really, really special. You know, deep down, I think that's what everybody wants.
In resus, doctors are waiting for 78-year-old Barry's X-ray results to determine what's causing his shortness of breath.
Put this in my bag so I don't forget it.
I would forget everything.
So you married me, is it?
Be my Mary.
Not much use for anything else. When we were first married, Barry definitely wanted to have children, and I didn't want to wait. I was really excited, looking all the time to see if I was pregnant. I thought it was as easy as that, but it seemed a great deal of time when you're waiting. We were both investigated, and we found out that we weren't going to produce a child. It was just very distressing. I just wanted to have a child.
Barry's X-ray results are back. They show he's got another chest infection.
His X-ray confirms that he got a build-up of fluid back again.
Oh, not again. I keep my hand there so you know I'm here. What's the matter? You looked quizzical. Was that at something you were seeing or because of yourself? Right, why did you look quizzical? You're feeling what, Barry?
More.
Breathless?
I've got a steroid injection I'm going to give you.
78-year-old Barry has been brought to resus with a recurring chest infection.
With the fluid collecting there, it does start a process of inflammation and irritation there, so it's helped to bring down that swelling.
Right, thank you.
No problem.
Okay. Anti-inflammatory, basically.
To clear up fluid on the lungs is difficult, and putting a tube inside somebody's chest is very invasive. You need to weigh up whether that risk of causing suffering is worth putting them through it.
Doctors will closely monitor how Barry responds to a course of treatment that should reduce the fluid levels in his lungs.
Could open your cards. I brought them with me. Want me to open them? Happy Father's Day. You're one in a million as a person. And totally awesome Happy Father's Day. And you put kisses. Don't know when you're going to collect them. When we had the diagnosis that we weren't likely to produce a child, we just decided that we would adopt it. We did say if we could, we'd like a baby, because we'd never been through that experience. And we had Rebecca when she was 4 weeks old. Magic. I remember the first time I picked up Rebecca, I said to Barry, I can't go home without her. You know, she was mine straight away. Someone asked me if she ate the same as us. Somebody else asked me if she would speak English. You feel sorry for people like that because they haven't grasped the essence of this is just a little human being, you know. We applied to adopt again and we were turned down. That was traumatic. I can't tell you how awful that was. We went to appeal and we took a picture of Rebecca with us to show, you know, our lovely daughter and look, we could do it once, surely you could trust us to do it again. And she said, she's irrelevant. And I looked at Barry and he put his hand out onto my knee to keep me calm because no one was going to call my daughter irrelevant. When when we calmed down, we just applied to other places. And happily, we had Anthony. And that weekend, my greatest delight was to take him out and buy him a pair of shoes. And it was such a joy. And the first time I bathed him, he was ours then, and even smelt like our family, if you know what I mean. Admit it, you only had me for the free tech support. That is so true, isn't it?
Was it hard being a mum of two?
I was feeling really tired. And I thought, oh, this can't go on, I must be anemic or something. So I made an appointment at the doctor's. She sort of checked me over and said, you seem to be okay. The only thing I can think of is that you're pregnant. And I went, no, we're the people you saw for medicals for adoption. She said, well, we'll do a pregnancy test just to rule that out. On Barry's 44th birthday, I came home and said, I'm pregnant. I said, sit down. I'm pregnant. When Nathaniel came along, people said to us, you must be pleased now to have one of your own. In fact, we used to find it quite offensive. We never thought of either of our two adopted children as not our own. We had to tell the children, and it went very quiet. Rebecca looked at us and she said, you needn't have had us then. I don't think in the next 5 minutes they were under any illusion that we would have done anything other than had them, but I couldn't believe that a 6-year-old could work that out.
Despite medication, Barry's condition is not improving. His x-rays have been sent to a specialist for further analysis.
You to just tickle my left nostril on the bottom.
Have the tissues there.
Just tickle it. Okay, sorry, my left eyebrow's itchy now. No, keep it in a bit. That's it.
Are you looking for me to hold it for you as well?
No, I'm an independent person.
Yeah, that's why you rang me and goes,
Okay, 1, 2, 3. Hold on, sir. Rest back there. That's it. Well done.
Last night, retired Deputy Head Teacher David fell down a staircase. Doctors need an x-ray to determine the full extent of his injuries.
I was born in a small cotton and coal town in Lancashire. I was, as a child, quite ailing. Rheumatic fever, German measles and this, that and the other. When my younger brother was conceived, my mum couldn't cope. And as happened quite often in those days, I was passed over to my aunt.
Okay, David, breathe in, hold your breath, and breathe away.
I was allegedly going to stay with my aunt until I got better, and there was one particular day etched in my memory. My father and my mother came to my aunt's house to take me home, and I had my little suitcase packed upstairs in my bedroom. And they came and I was asked to go out to play, which I did. And when I came back, they just said quite simply, we've decided you're going to stay. And so I grew up believing that I was bad.
Ready? 1, 2, 3.
What was your aunt like? Was she loving?
In a northern, distant sort of way, yes. We never had any physical affection. We didn't kiss each other and hug each other, which I guess as a small child I missed. I became quite hard. Not very sentimental, I guess. It turned me into a rather aggressive bully, if anything. I was good at boxing, so I took up boxing and like hitting other boys. It was good.
On now, David, should we do your toes?
What's it like to sort of admit that?
I didn't at the time. I thought I was perfectly justified. But obviously, as I grew up and looked back, yes, I thought that wasn't very nice, was it?
Oh,
Thank you very much indeed.
Hi, sir. Mr. Payne, is it?
Yes.
Hi there.
Here they come.
I'm Jonathan.
Here they come.
I'm one of the plastic surgery registrars. What I need to do is take down the dressing and have a look and see what the damage is.
Retired coach driver Bob had an accident at home doing DIY. His multiple injuries were dressed at the scene by paramedics.
Just tell me if I'm causing any pain, sir, OK?
Will do. I met my wife while I was driving coaches. She was one of my passengers.
Mum had treated us to a trip to Ramsgate. We were in the back seat. He was looking in the mirror as he was driving along. Quite nice looking, actually. His hair had got blonded because he'd been down on the beach a lot, and he kept looking. That was why I noticed him.
I can't remember ever passing a driving test, to be quite truthful. When I was coaching, it was a great life. You were on your own. You didn't have anybody peering over your shoulder. It was fun. If we weren't in Hastings in the pub, drinking our first pint by 12 o'clock, we were late.
Now, that plaster's from yesterday.
And how did you do that yesterday?
With a saw.
OK.
I'm sensing a theme.
On this hand, you've cut through the tendon which straightens the finger. You've cut through those.
No, what made me laugh was I've done the same thing.
Did you?
With that one.
When did you realise this man has a few more accidents than most?
When I met him, he followed us down on the beach and he was smoking a pipe. He went along the breakwaters, but he slipped and he crunched his chin on the pipe, so he ruined his front teeth. So he really fell for me, poor bloke.
The foot will need to be stitched, and then on the toe, you've cut through the tendon as well. You'll be fine with walking. The main issue is going to be that you won't be able to use that hand normally for several weeks.
That means you can't roll a fag.
Oh, that's a shame.
Bob will need surgery to repair his severed tendons.
What are we going to do about you, eh?
I'm sorry, kids.
Don't be sorry.
Just don't do it again. No electricals anymore. No electricals, full stop.
Is your pain okay now?
I feel OK, you know, with the morphine too, a bit sort of woozy, you know.
Yeah.
Last night, 75-year-old David fell down a flight of stairs. His x-rays reveal a cracked sternum, 6 fractured ribs and a broken toe.
Are you able to take deep breaths?
I keep trying to make sure I do.
Because the problem with rib fractures, sometimes because of the pain, people aren't able to take deep breaths.
I know.
And then you can end up getting
That's right.
chest infection.
I was a scholarship boy, got into a posh school in Bolton, and not allowed to do science and maths, because that was for the clever people. I had to do the easy subjects like English, French and German, you know, which any fool can do, they said. University knocked all that nonsense out of me. That opened my eyes to the fact that I was actually as clever as the others, really. I knew that I was going to do teaching. I really felt that that was what I wanted to do, because I just felt that education and schooling could make complete difference in people's lives. I seemed to take to it like duck to water, really.
David was at the school when I started teaching there. He was quite scary when we were at school. The kids were terrified of him, and so were the teachers. But he was a really, really good teacher.
So being a bully as a child stood me in good stead as a teacher and deputy head, really. I was able to say to parents in all honesty that there was no bullying in this school, only from me. And they quite liked that, you know, they felt secure that there weren't any other bullies. Because at least I could restrain myself then, I didn't hit anybody.
Ow! Sorry. Is that better?
That's brilliant, thank you, yes.
Okay.
Doctors have decided to admit David onto a ward to continue his recovery after fracturing 6 ribs.
Ah. Oh dear, you poor things. Honestly, there's bugger all that's happening, and
So we might as well go.
they've taken some x-rays of my toe and my
Oh, your
shoulder.
toe as well?
So how did you do that?
Did that scare you, did it?
Yeah.
Did you
I
tell
said I
them?
kicked the bloody wall. What do you think I did? Oh, don't do it. Oh, you bugger. Oh.
I'm sorry.
Oh, dear. I feel that I'm just in a bad dream, really. I'll wake up and I'll only kick the door.
Did you ever miss your real family?
Not at all. From a young age, I never felt too strongly about the pull of family.
I need something, though, to boost my confidence.
Oh, there you are.
Bloody thing.
I think I look back now with regret that I didn't show my aunt and uncle close affection. They would do anything for me and spoiled me rotten. You know, nothing was too much trouble. When my aunt died, my uncle eventually got dementia and came to live with us. And I remember with gratitude that I was able to physically nurse him in his final years, clean him and wash him and things like this. He didn't know me, but I sat with him when he died. I was able to link with him emotionally very powerfully. Did me a lot of good, you know, it made me feel that I'd made up a bit for my coldness earlier.
'78-year-old Barry arrived in A&E earlier today. He's being treated for fluid on the lungs. Geriatric specialist Dr. Shabazz has compared Barry's recent x-rays.
My name's Shabazz. Nice to meet you.
Nice to meet you.
I'm sorry you've come back into hospital.
So am I.
Yeah.
Sorry.
No, it's not very nice for you. You've got a build-up of the fluid, I'm afraid, in your lung again.
Yeah.
But ultimately, we need to put this drain in to drain off that fluid. I know. How are you feeling?
I mean,
Concentrate, Barry.
ah.
Okay, all right.
All my married life, I have lived with this very intelligent, knowing man. He was just a font of knowledge. He spent some time in the RAF, and then he used to work in research and development. And eventually, by recommendation, he got a job at the MOD, and that's all I can say about that. It started to be that he wasn't remembering things. He forgot my birthday. I'd opened my cards and I was expecting him to sort of produce one, and he didn't. And in the end, I had to say, "Oh, did you get me a card?" And he said, "Oh no, I didn't get out to get it this time." I suppose that's when it registered quite strongly. But I didn't want to broach the subject because it's a hurtful thing to have to say, isn't it? That, you know, I don't think you're the person you were.
I'll show you the X-ray. The fluid's reaccumulated. Oh.
Sorry.
Do you want to sit down?
Sorry.
So that's the crux of the problem, basically.
Oh, dear.
You definitely did the right thing bringing him in.
Doctors have discovered dangerous levels of fluid in Barry's lungs and have decided to insert a chest drain. His wife Irene has been taken to the relatives' room.
So I'm not sure why it's reaccumulated.
Right.
It could be pneumonia which hasn't quite gone away, and we'll look into that when we take some fluid off today and make him more comfortable. What I wanted to also ask you is about, in case this has been brought up before in the past, with resuscitation status as well. I know it's not a very nice chat, but it's something
I don't know what Barry would feel.
He hasn't expressed any wishes? Or...
No, not really.
OK.
If his heart stopped, is there anything you can do, and what would it be if you could restart it?
It's variable, the outcome. Quite a lot of people who end up going to ITU, they don't come back the same condition that they were before they came into hospital.
Yeah, I understand. You're being very pleasant about it, and I'm going to be upset, but you understand.
I do apologise. I wasn't sure if this subject had been approached before.
I'd let him decide. I would talk to him about it because he's... There's no nice way of saying it. Sorry. I don't want to waste your time by just crying, but I can't help it.
That's perfectly fine. You're not wasting time.
Have you any idea of the likelihood of that happening, just for my peace of mind or absence?
I'm not anticipating it's going to happen today or tomorrow or immediately.
But if it were, you just want to not have to bring all this up at the time.
Yes, because it's quite...
I respect that.
Would you like me to speak to him about this?
Selfishly, I know he cares for me and he would want to do what was best for me, believe it or not. But I can't.
When I think about the fact that I'm going to see my family going through all of these issues that I've been witnessing for the last 10 years of my career, that worries me more than myself getting old. I think you just have to hope that when you are old, you've got plenty of people around you to support you and to love you.
Give me a hand, because I need to talk to you about this. They said, have we talked anything about resuscitation? I said I would talk to you about it, not because it's going to happen now, but you can make the decision now when it's your decision to make. If anything happened and your heart went or your lungs went, do you want to be resuscitated?
If I was resuscitated with not very good
quality of life. Yeah.
I see no point in going to life again without...
having some life.
You wouldn't like that, would you?
I would do whatever you wanted, but if you weren't going to be communicating with me, then they can let you go.
Yeah.
Okay, thank you. I'm sorry then. And I will. Shall I say now, and then we don't have to have the conversation again?
Yeah.
Were you comfortable with the answer?
Yes. Yeah. He wouldn't want to be a burden to me, and I wouldn't want to be a burden to him. It's different if you can talk and communicate in any way. But if you can't communicate and people are just spending time with you in sadness, you're just making it worse for them, aren't you, really?
this has been a very salutary lesson in the complexity of the brain and how wonderful it is, really. And I just find it a little amusing that after all this time I can be just as daft as anybody, you know.
What do you think has given you the greatest happiness in life?
My children and my wife. There's a lot of people I can thank for this. If I'm well enough, I'll be happy.
St George's Emergency Department. Fell out of a tree, yeah.
Andy's 48. He landed straight onto his feet.
Oh my God, Jesus Christ.
In the worst case scenarios, if not treated, then all of the muscle dies and you could end up having to amputate. Can you feel me touching your hand underneath here?
No, I can't feel anything there.
I was worried that he would never be able to walk again.
Oh, my God.